There are certain days that are simply getting students to and from their sessions. There are other days where I have more time to prepare social emotional learning lessons, also just integrating myself within the staff, recess duty, even participating in gym class. You get to see the kids, especially the younger ones, learn how to regulate their emotions, and it clicks. And then seeing them out in the hallway utilizing what they learned instead of just kind of blowing it off.
I usually get into the school around 7:30 in the morning. It's a good time to see kids first off, see what their moods might be for the day. I check my calendar for the day, recheck it again, see who we have down for telehealth sessions, check our electronic medical record from the healthcare center to see if there have been any changes there. Sometimes there are. Then I check the absence list for kids once that comes out. That way it doesn't conflict with what I have planned for the morning and finding students who might not be there for one reason or another. That's the main part of my day, is getting kids into telehealth appointments, and that's what I focus on. And then I help out however else is necessary throughout the school. I also do every day take a little bit of load off the staff while it's their lunchtime, doing a lunch coverage and a recess coverage for an hour during the day. Bringing a student to an appointment, like I said, first off, making sure that they are here. I check in with their teacher usually before, kind of say, I've got Johnny at 9 o'clock, I'll see you a few minutes before. Let them know that, then I'll come back, pick them up for the appointment. I'll by that time have confirmed that the room is actually available and have everything set up in there. I find them at the couple minutes before, make sure the MacBook's available for the team's appointment with our provider, and try and do it right on the dot because I know her time is valuable. I would think the after-school pieces are important because I get to know the kids who are taking part in behavioral health and telehealth, and then I get to see them in another realm, which a lot of kids are also involved in after-school stuff.
I have been very lucky. I've been in this community for 10 years, so a lot of people know me and I guess I earned their trust already on a personal level. Once in the school, I attended staff meetings, school board meetings, answered questions that they may have had.
It was a little different coming on just because I started after the school year had begun last year when it was my first school year. Once I did get here, I made sure that I attended the first staff meeting before I even was in the school. I feel like I have a great relationship with everyone on the staff.
Like any new program or event that's implemented, the first year is all about change. How can we make it work? So there's going to be struggles. The first year is integrating me being a new staff member. And compared to this year, we have gotten a routine down. We've had everything set in stone, and it's just run smoothly this year. Having the kids get to see me and look at me as another staff member and not just someone who I'm going to take you to your therapy session because you need it. So they got to know me on a more personal level, and they've opened up a lot more to me.
The biggest barrier this year is a dedicated space to have our sessions. It's just difficult without a dedicated space for the program for the students to have their sessions.
I would say the biggest barrier would have to be miscommunication. Sometimes I like to say there's too many hands in the pot. So somebody might need to know something but not be aware of it because someone told the other person. So the biggest communication barrier that I have is working with an external provider.
The word I keep coming back to that I used a couple of weeks ago was seamless. It's been great. We have some kids back from last year. We've got kids that are new for this year, and we are currently at 21 students out of our population of 110 that are getting services. So it's been a great start.
The secret is to be knowledgeable and confident about the program and the benefits. So we started out as not fully understanding the benefits as the parents would have conversations with us. But once we explained that sessions would be happening in school, less transportation, no wait list for your child, they seemed to be open more about it. Being knowledgeable and confident allows students, community, and school even to have unmet needs to be seen, not just by me, but everyone else in the school and everyone else in the community.
I always say it can't not be the kids. It's just they have difficult days, they have hard days, but just the times that they want to engage with you, when I don't make them engage with me, I let them come to me. Some of them are more willing than others, and some of them I know a lot better than others. Just trying to make them feel like it's a good place to be in this school.
For this job, I would do self-reflection and ask, is this the type of job that I want? Am I willing to advocate for students and the community and families? Are you able to remain non-judgmental, especially in a small town where rumors and word of mouth comes by every day? Are you a team player because you have to collaborate with a lot, the staff members, providers, students, families? So just doing a lot of self-reflection and making sure that you know what the job entails and being okay with it.
You can't fake it if you don't want to work with kids. You really have to enjoy it. Be ready to be asked a lot of questions that you might not know the answer to, that you'll need to find the answer out to when you're first starting. You've got to be able to deal with a lot of different people in the environment at that time to be able to make things all work out.
The barriers that really got to me was more of mental health stigma in general and how much it truly affects kids. We live in a community where the older generation, it was you dealt with your problems and never went to get help. So once that barrier kind of broke down a little bit, I was welcomed even more with parents and students themselves.